an hours-long grilling. Health and Human Services Secretary Robert F. Kennedy Jr. pressed about his tenure by the Senate Finance Committee, facing tough questions from both Democrats and Republicans as the impacts of his controversial decisions, from vaccine policy to CDC chaos, began to ripple out across the country. But he seemed to get a signal of support from perhaps the only person who really matters.
I didn't get to watch the hearings today, but he's a very good person. And he means very well, and he's got some little different ideas.
Joining us now is MSNBC senior enterprise reporter Brandy Zadrozny. I mean, Brandy, this was one of the most fiery hearings we have seen in the second Trump administration. What were your key takeaways?
Yeah, well, first of all, I thought it was really notable that we had sitting senators calling the head of HHS a liar multiple times.
And a charlatan.
And a charlatan, yeah. It was and a danger to public health. That was really notable. And I think it was really helpful and notable that they called him out. They said, excuse me, you said you wouldn't take away vaccines, but in effect, by recommending these data-free new recommendations for COVID shots, you are taking them away in more than a dozen states. It's impossible or very, very difficult for people who want those vaccines to access them. So that lie was called out, and I thought it was really helpful. The second thing that was really interesting is that we heard from Cassidy for the first time. It was he's a doctor, he's a Louisiana senator, and we were wondering, is he finally going to step up after he helped push his nomination over the edge? He helped him get there. Is he going to step up and say something? And he really, really did. He was very forceful. And he did a very interesting thing, which is he sought to create a wedge between the president and RFK Jr. So he didn't go out necessarily on the attack, but he said, do you think that Trump, like I think, should get a Nobel Prize, which we know is very near and dear to the president's heart, over Operation Warp Speed? And, Kennedy fumbled a lot. And I think the last thing that really stuck with me is that I think Kennedy is setting us up right now for a real divide in the country and how we get our health care. So because he's made it so hard to get vaccines, and he's only going to make it harder with the childhood schedule, he signaled that yesterday. What's going to happen now is we're going to have certain states that make it easy to get childhood vaccines and require them for school, and we're going to have certain states that don't. And you will start to see, because diseases don't care about your politics, you will start to see a nation in which half of its kids are sicker and have a bigger chance of dying from preventable diseases than the other half of their kids. We saw it during COVID, where in red states, people died at disparate amounts than people in blue states. Republicans were sending this message, don't get a COVID vaccine, and so a lot of didn't, and a lot of people died. Now, this is gonna target children.
And one of the consequences already that we're seeing is, because of so much misinformation and lack of clarity, there's a lot of confusion. People don't know who to believe and to believe about what, especially when it comes to COVID now. And Secretary Kennedy received a lot of questions from the senators about those COVID vaccines and some of the choices and policies he's now instilled around them. And he still struggled to answer and still struggled to show information that would back his beliefs. Let's watch one of those exchanges.
Would you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that, because there was so much data chaos coming out of the CDC.
The Secretary of Health and Human Services doesn't know how many Americans died from COVID. Doesn't know if the vaccine helped prevent any deaths. And you are sitting as Secretary of Health and Human Services? How can you be that ignorant?
Brady, these are people's lives. What do we know? What should he have known?
To back up, what you have to understand, and what was very much on display, and what our viewers have to understand, is that Kennedy's entire belief system when it comes to vaccines are that your doctor is lying to you because they are covering up for Big Pharma because they get paid from Big Pharma. They're in on it. The politicians who grilled Kennedy yesterday, they're in on it too. The people of the CDC, the doctors, the senior officials who left, they're all in it too. You can't trust anybody but Kennedy and his handful of anti-vaccine people that he has put in place personally who run HHS right now. It's a pretty terrifying thing, which is why, people and health officials and groups like the American Academy of Pediatrics are separating themselves. He's breaking down this institution. They're building other ones. Again, these Western states now have their own group that's working out. And your doctor, it is unfortunately, and senior officials have told us this, you can no longer trust the CDC and HHS at this moment with your health. It's time to look to other institutions, and there are people building them.
All right. Thank you so much, Brandy Zadrozny. Always good to have you here. And joining us now is Dr. Nirav Shah. He's a former principal deputy director for the CDC. He also led Maine through the COVID-19 pandemic. Doctor, great to have you. After what we heard from Secretary Kennedy, I want to just start out with a simple question. Is the new COVID booster safe? And if you're able to, should you get it?
The answer to both of those questions is an unequivocal yes. The COVID shot is perhaps one of the most studied vaccines, indeed, probably one of the most studied medical interventions that we've ever had on the planet, with literally billions of doses having been administered. It is not only safe, it's also effective. And frankly, as we go into the fall and winter season, it is your best defense of staying out of the hospital from COVID.
Democratic Governor Maura Healey of Massachusetts was on with our colleague Jen Psaki last night discussing what appears to be America's future, a patchwork system of medical guidance. Take a listen.
We're going to need to work together as states to basically backfill the federal government and the Trump administration's total abdication of responsibility when it comes to public health. What does that mean? It means we're going to be working together as states to do disease monitoring, to look at the data, to share the data. We're going to work together on things like emergency preparedness, things that the CDC and HHS typically was a federal partner to states on. And not only are they no longer a federal partner, they're actively undermining public health in our states.
So, Doctor, if states go their own way, what are the risks on the horizon in a country with this type of healthcare system?
Well, that's the exact right question. You know, what we have in this country as a public health matter is we don't have a national public health system. We have a nationwide public health system that's constituted by the states, but with overarching guidance and support by the U.S. CDC. The fact that now different groups and segments of states are banding together to go their own way is the only path forward, but it is not the best outcome. The best outcome would have been the system that had been in place for 80 years, where the CDC was the overarching authority. What are the implications of this? Well, as your prior guest noted, it will mean that public health services may vary based on the state that you live in. Some folks may have better access to water, clean air, safe food, and vaccines, and other states may choose to take more of a choose-your-own-adventure approach to public health. That is not what we should expect from our elected officials. Public health has been one of the reasons why life expectancy has ballooned so much in the past several decades, and we should want it for all Americans, not just a subset.
Your former place, the CDC, seems to be in crisis right now, and there were multiple tense exchanges over Secretary Kennedy's move to oust the now former CDC director, someone he initially picked for the position. Watch this.
You tell the head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign?
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no.
Just want to pick up on Senator Warren's point. Are you telling us that the former head of CDC went to you, you asked her, are you a trustworthy person? And she said, no, I am not a trustworthy person?
She didn't say, no, I'm not a trustworthy person. She said, no.
Doctor, is that believable? Do you believe Secretary Kennedy?
I don't find his telling of that story to be credible at all. In all of my years working in government or in the private sector, I have never, as a manager, asked any of my staff if they are trustworthy, nor have I ever been asked. No part of that story is credible. What you're really seeing for the first time in this hearing yesterday is a man like Secretary Kennedy being held accountable for perhaps the first time in a very long time. And we saw the implications of that. He could not answer questions squarely. He had no command of the facts. And when he didn't have an answer, he engaged in the same playbook he's always engaged in. He denied what he's doing. He disparaged those who are coming after him. And frankly, he's trying to destroy the entire edifice. He doesn't have arguments, so he resorts to ad hominem attacks.